Health officials are warning today about the largest outbreak of tuberculosis ever recorded in the U.S.
Since the beginning of this year, there have been 67 symptomatic cases in the state of Kansas, split between 2 counties in the Kansas City suburbs. Health officials say that's on top of 79 so-called latent or inactive cases where someone tested positive for the disease but is not showing symptoms.
Joining us now to talk about this, Dr. Nahid Badelia. She's an infectious disease physician and founding director of Boston University's Center on Emerging Infectious Diseases. So the perfect person to talk to. Doctor, thank you for being with us. How rare is this outbreak, and how fast does tuberculosis spread?
Yeah, what we're seeing in Kansas is against a backdrop of increasing number of TB cases in the U.S. actually for the last 3 years. In 2023, U.S. reported almost 10,000 TB cases, which is the largest since 2013. And the reason we're seeing that is because globally we're seeing increased number of cases, particularly with disruptions in the aftermath of the COVID-19 pandemic, over 8 million cases. So in this particular scenario, the concern is finding people who are actively infected quickly and isolating them and giving them treatment, because that treatment decreases their capacity to transmit to others. As long as that is done, as the Kansas Department of Public Health says, this is low risk to the general public.
And doctor, you mentioned finding people with symptoms. We did mention earlier there are some cases where people are showing symptoms and others where they're not. So how do we know when we should see a doctor?
Yeah, in either case, if you think you've been exposed to tuberculosis, you should see a doctor, because you may have something that's called latent TB, which is you're not transmissible, you can't infect other people, but you may have the bacteria in your body, and there's a risk that further down in your life, you may activate that. So getting treatment avoids that from happening. What we're really concerned about are people who have been exposed and they have active infection, and that's, weeks of weight loss, fevers, night sweats, productive cough, particularly tuberculosis cough with, blood-tinged sputum, is what we're really concerned about. And that's when we isolate and provide treatment acutely to make sure that there's no further transmission within the household.
And for those of us who are well, how do we protect ourselves from getting tuberculosis? Should we consider getting tested? Are there even tests to make that possible?
Yeah. The biggest thing to know is that this is still pretty low risk to the general public. In the areas where the outbreaks are going on, if there's a risk that you may have been exposed, the best thing you can do is contact your primary care physician, and they may either bring you in to do a blood test or a skin test, tuberculin skin test, to test you for latent tuberculosis. If you think you might have those other symptoms, best thing is to give a call, and they may bring you to the hospital to test you more intensively to provide you with treatment.
Really great information. Dr. Nahid Badelia, thanks so much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app, or follow us on social media.